You and Your Health with Dr. Richard Okoye.
Hello, nice meeting you at this very junction. I'm Dr. Richard Okoye, the president of Doctors Save a Life Foundation, a non-governmental organization with a clear vision of giving total help to the people of Africa through the power of knowledge. I'm here to share something that will be quite beneficial to you, to your parents, particularly with respect to aging. Today, you could be in position to see a number of our parents, our loved ones, dying and living, aging in pains, as if pain is synonymous with aging. But I will tell you honestly, that is as a result of something that ought to be done, which we may have not known. A number of people have done a lot about arthritis, and are they going to live in pain forever? Now we tell you what is obtainable in the modern world. Alright, now to get a picture of arthritis nicely, arthritis is simply, by medical definition, inflammation of one or more joints. Look at this very normal joint. You can see there is a connection between this very bone and this, and they can easily move freely. Two bones coming together, they have a cartilage over them that can enable them to move freely. Okay? But when there is a damage to this particular cartilage, what happens? There will not be bone-to-bone friction. You know what? That could be likened to a hinge door. A door that has a hinge, if we're greased, if everything is okay, it opens nicely, there will be no noise. But over the time of leaving it and it gets rusted, you know what happens? When you are opening same door, you will be hearing it will make a lot of noise, isn't it? Same is also applicable to human knees and hips. In that case, if the synovial fluid, if the cartilage on that particular bone has damage, it will not be bone to bone and all the pains of the very friction going on. You see, some of the fathers, some of the mothers could be in position even to get up from bed. It will to get up. You see tears. How long can they live their life? You see a number of our fathers, our mothers, our loved ones living life as if life has been summarized in pains. To get up from bed is a problem. To stand up from a chair is a problem. You will hear that some of them, you want to pick them up from bed. You will don't mind me, because I've seen a number of them in the hospital. That's why I can be in position to mimic such a. But it is not something that could be imagined, something that could be wished for anyone. Now, let me tell you this. You can have this arthritis in different formats. Number one, you can have what is called mild arthritis. But first of all, let's look at the issue of the hip. And you can see the relationship between the hip bones, the head of the femur attaching to the acetabulum. If you can see that relationship, the head of the femur and everywhere is very smooth. But look at this other one. You can see that this cartilage is now eating up gradually. That's what is called mild osteoarthritis. You can see when you advance further, it's what is called moderate osteoarthritis. And you can see when the whole surface is damaged, and that one is called advanced osteoarthritis. At that particular point, issue of massage, issue of drugs, issue of physiotherapy at that particular point may not make all the difference. At that point, I tell you, the best option to go is what is called joint replacement. It can be in position to replace that particular angle, that particular head that is damaged. Also the knee, the ankle, all these are available right now in our own time. Before this time around, we fly people abroad for things of this very nature. But thank God today in Nigeria, those implants, even the latest implants that you can do, semi-constrained and constrained joint replacement. And thank God also that most of those implants are now available or can be accessed here in Nigeria. It's so painful that you see a number of people will travel abroad because of this, and on coming back because of the stress and the rigorism of moving from one airport to another, they still have another problem. Now, let's take the history the way it is. In this side of the world, we believe so much in traditional bone setting. No problem about that. At least we must start from somewhere. Most importantly is the dangers of trying to tie someone's hand. A number of people will have a simple fracture, particularly if it has wound, and they will not go and tie it. Oh, come on, I tell you something. I have a very, very ugly experience recently of a young boy, very ambitious young man, as a matter of fact, but unfortunately he fell and broke his hand. They took him to one native place, tied the hand, and the hand got decayed. Option to this, cut off this very hand of this young man full of ambition of what to become tomorrow. Have a look at this. Can you see just a simple bone that was just cut, but left somewhere, the hand got decayed? A number of such, you can see a lot and lots and lots of them. That's the things our people suffer in secret. Nobody knows what to do. Also, when there's a fracture, that like issue of gunshot injury or issue of accident or something that happened for which the bone scattered, my friend, don't say no. There's a native. You will kill that person. You can kill that person from infection. You may leave that person permanently in pains. Some of them will finish, the legs will not be that they can't use the leg again. What happened? In that case, there's a particular equipment called CR. In the course of doing a procedure like that, look at this very CR. This particular machine enables you to see the bone. As you are setting it and trying to position it, it will be guiding you during the process of doing this orthopedic procedure. But what happened here? Our own people will say, no, take to native. At the end of the day, this young man or young girl will be made useless on something that is preventable. My advice is that if you have a bone problem, it is important you get to a center with a good orthopedic facility. And also, if you have issue that has to do with arthritis, having advanced, go for joint replacement. Thank God it's available in Nigeria. I tell you, you will have a lot to gain with respect to your time back to work, and also with respect to living a life that will be meaningful. I know and I'm convinced that God never made old age to be for suffering. It's meant for us to enjoy old age. We cannot afford to see our loved ones, our parents, living and dying in pain when they ought to eat the fruit of their labor. I want to encourage every one of us. There is a better life to live, even in old age, when the right thing is done with respect to arthritis and also bone management. Thank you. Share this message to your loved ones, even as we together build a healthy country, a healthy nation, and also a healthy Africa. I remain your friend, Dr. Richard Okoye, the president of Doctors Save a Life Foundation, with a clear vision of giving total health to the people of Africa through the power of knowledge. See you some other time.